Alrighty, welcome everybody. We'll go ahead and get started with the Makah EOC public briefing. Today's August 3rd, 2021. We'll start off with Dr. Cope. Are you ready?
Yes, thank you, Chief Bruner. Let me just pull up my, sorry, Erica, if you can enable screen sharing, that would be great.
Okay, go ahead, Libby.
Okay, thank you. All right. Okay, good morning, everyone. Thank you so much to everyone who's on this call and to everyone who's watching this later after it's been posted. I realize I'm just looking up at the slide right now and it says August 4th, but I believe that's incorrect. So just for the record, please note that this is the EOC briefing that's happening on August 3rd. At this time, we have 6 active cases of COVID in Nia Bay. One of our patients has recovered. And so we had 7 yesterday. That has gone down to 6. 4 of those cases are unvaccinated individuals and 2 are vaccinated individuals. We have 20 cases total. This was reported, there was an error in our reporting yesterday that said 19. That is not a new case. We have 20 after we've redone our counts. And again, my apologies, yesterday just got a little busy. So we have 20 cases total and 15 households in official quarantine. Clallam County is still high risk, and their rate of cases and their percent positive has continued to go up. It's at 6.8%. We consider high risk anything over 2%. Most of their cases are in unvaccinated individuals, and that's pretty consistent with most jurisdictions as well. They have 6 current hospitalizations. That's 2 new hospitalizations this week. They've not had any new recent fatalities. And this is just a graph demonstrating where they're at in terms of the rate of new cases. Clearly there's a spike happening there. This is Washington State's data. They are also experiencing a pretty rapidly accelerating rate of new cases. This is our weekly report on the variants of concern in Washington State. I'm just going to highlight down here the Delta, the 3rd column from the top. This is the Delta variant, which is pretty widely in the news. So if you can see the jump from 800 to nearly 1,500 just in 1 week. So there's still only 15 confirmed cases in Clallam County. I am sure there's more, and I'm sure this number will jump again. So I just want to, this rate of increase in the Delta cases is what we're paying attention to. It's highly transmissible. Current treatments are somewhat less effective. Our vaccine does appear to be effective for, all of the vaccines appear to be mostly effective for preventing serious illness. The Moderna and Pfizer vaccines are reportedly somewhat more effective than Johnson & Johnson, but all of them do appear to be effective for preventing serious illness from the Delta variant of COVID-19. These are all the variants of interest that are just being watched, but are not yet variants of concern. So frequently asked question, are the cases that we have here in Nia Bay caused by the Delta variant? We don't know yet, but it's very possible. So all of the cases we're in contact with the Department of Health, and we may get them tested if we can. It all depends on the amount of virus that's in the swab that's taken. So we may have to come back to some of the patients and retest, but we are currently working with them on that. Regardless, it takes at least 2 to 3 weeks to get those results. But acting as if they are the Delta variant, clearly they are highly transmissible. Whatever we do have and is transmitting somewhat quicker than we would have anticipated based on what we're getting from the case and contact tracing. So again, we don't know. I will report as soon as we do know, but it's more important to act as if it is. So where do we go from here? We've got 4 really, really key steps that I wanted to focus on, and my main message today was to emphasize these 4 steps. So number 1, get vaccinated. If you have not gotten vaccinated yet and you are on the fence or you have concerns, our medical staff are all available. Dr. Eastburn is more than happy to have individual one-on-one conversations with anyone who is just on the fence, or even if you're a hard no and you just want to talk about what your reasons are. I am also available and would be happy to talk to anyone. But without the vaccine, this pandemic will not end without the vaccine. And I want to emphasize that we've seen that in several other pandemics in the past. Getting to what is known as herd immunity or community immunity never fully ended those pandemics. For example, smallpox was one that we needed a vaccine in order to get over. So please encourage your family and friends who are on the fence to talk to any of our staff here at the clinic, specifically Dr. Eastburn or a medical provider that they trust. We have all of the vaccines here at STIC for individuals 12 and up. Yeah, so that's my plug there. Get vaccinated. Second thing is to wear a mask, regardless of vaccine status. At this point, we really need folks who are around someone who's unvaccinated. And remember, this includes anyone under 12 to wear a mask. Obviously not your own kids or in your own household group, but those outside of your household group. Wear a mask anytime you're not sure about the vaccine or travel status of everyone that you're around. And then just wearing a mask anytime you're in public indoor spaces over your mouth and your nose. Step 3, avoid high-risk activities. So high-risk activities are everything here on the right. So those indoor parties, restaurants, playing contact sports, air travel, public transportation. These are all high-risk areas or high-risk activities. You can participate in them and do them safely, wearing masks and being aware of the mask wearing status of those around you. So I understand that several of those activities are not completely avoidable, but be aware of how risky they are, and then strive to do less of them. And when you have to do a high risk activity, go into preventive quarantine. So anytime you've had close contact with others, which the technical definition is 15 minutes without masks and closer than 6 feet apart. However, transmission can take place in a 2 or 20-second hug, or just staying in somebody's house, even if you've worn masks, etc. So anytime you've taken any risks on that right side of the chart I just showed, what you want to do is avoid close contact with others outside of your household group for 14 days. You can go to work. There should be no close contact at work. So that's preventive quarantine. I did want to talk just a little bit about isolation and quarantine and just provide a refresher. I know we've had Glenda Butler, who's our lead isolation and quarantine nurse. She is actually out of the office this week. So we have Michelle Hitchens and Valerie Kaiser doing all of that work for us this week. But a reminder that isolation and quarantine is, we do it for 14 days from the date of exposure or the onset of symptoms. Someone is placed in isolation or quarantine regardless of vaccine status or test results. So if you've had close contact with somebody who has COVID and you've been contacted by our case and contact tracer, even if your rapid test comes back negative, and if your PCR test also comes back negative, you still have to quarantine for that 14 days. So I just want to make sure that is clear. And then we also here in Neah Bay, we do quarantine regardless of vaccine status. I understand that the CDC and Washington State do not always do quarantine for somebody who's been exposed if they've been fully vaccinated. But we have different goals here. We're trying to prevent the loss of any life from COVID. And that's why we are striving to go further than what the CDC in Washington State does. And just so everyone knows, the stick absolutely does not separate children from parents or guardians or their caretakers. So we will work very closely with our families, with our households to make sure that everyone who needs to be taken care of is being taken care of. So I wanted to make sure that was addressed and understood. And that's it for me. And I will just pause here for any questions.
All right, well, thank you, Dr. Cope. We appreciate the update and all the swift information. I don't see any questions posed at this time, so I'll move on to Patty. You have an update for the organization, please.
Good morning, everyone. The only update I have is that the small business application period was open for 2 weeks, and that closed this past Friday at 4 o'clock. And now they're being reviewed and will be sent over to council. That's all I have.
All right, well, thank you, Patty. Appreciate the hard work and everything. Just have a few reminders from the Makah EOC. At this point in time, we are currently in shelter in place. That will be in place until the health order changes or we have any other evolving situations. Mask mandates are in effect for all public places, tribal buildings once upon reopening. Just want to remind everybody, be safe while you're traveling. If you have to travel outside of Nia Bay, please take those safety precautions and safety measures serious and implement them as you travel. Please also check stick.org. This briefing will be posted on there at a later time, and also updated information is consistently changing and evolving, and it is put up on the website. Please wear your mask, vaccinated or not. Other than that, I want to thank everybody for attending. Thank you for everything that you've done so far and up to this point, and we'll continue to keep working. If you have any questions, please reach out to the Makah EOC, the STIC staff. They are available. I want to thank everybody for all the efforts that they've done, and especially thank you to the Makah Tribal Council. We're all facing this together, so keep your head up, keep moving forward, take all safety precautions that you can, and I want to thank everybody for attending today. So thank you.
Thank you.